Hello everyone, welcome to my channel. I am Dr. Swati Mehta and our today's topic is Gestational Trophoblastic Disease and its homeopathic treatment. Gestational Trophoblastic Disease is broadly classified into two categories, benign and malignant forms. Benign includes hydatidiform mole, which can be complete or incomplete, and it can be curable with the help of homeopathic medicines. Malignant forms includes invasive mole, choriocarcinoma, and placental site trophoblastic tumor. This requires the help of allied medicines, and for the removing of side effects of allied medicine, we can use homeopathic medicines. The term gestational trophoblastic tumors has been applied to the later three conditions. The first one is arise from the trophoblastic elements. Second, retain the invasive tendency of the normal placenta or metastasis. Third, keep secretion of human chorion gonadotrophin. Gestational trophoblastic disease is a benign neoplasm of chorionic villi. It is characterized by abnormal proliferation of trophoblastic tissue, swelling of the villi, and absence of blood vessels. This leads to early death of the embryo. Pathological and clinical classification. In case of pathological classification, it is hydatidiform mole, complete or incomplete, invasive mole, placental site trophoblastic tumor, and chorion carcinoma. If in case of clinical classification, we can see hydatidiform mole, complete or incomplete, must be benign, sometimes malignant but non-metastatic. Invasive mole is malignant, non-metastatic or metastatic. Placental site trophoblastic tumor, malignant, non-metastatic or metastatic, and chorion carcinoma also malignant, non-metastatic and metastatic. And they are having high risk or include low risk also. A hydatidiform mole is a condition where the placenta develops abnormally. There is excessive growth of trophoblastic tissue instead of normal fetal development. The etiology of hydatidiform mole remains unclear, but it appears to be due to abnormal gametogenesis and fertilization. And here, vesicular swelling of the placental villi and usually the absence of an intact fetus. There are two types of molar pregnancy, partial mole and complete mole. In partial mole, some fetus tissue may be present and it usually results from fertilization by two sperms. In complete mole, there is no fetus and the tissue is entirely abnormal, formed from parental chromosomes only. In a partial mole, abnormal tissue grows along with a defective fetus. However, the fetus cannot survive. In complete mole, there is no fetus at all. Only abnormal tissue is present. These images demonstrate the difference between complete and partial moles. Complete mole shows parental chromosomes only. Partial mole, well, two sperms fertilized an ovum. The pathology of hydatidiform mole, the uterus is filled with fluid-filled grape-like vesicles. There are swollen chorionic villi without blood supply, leading to embryo death. There is excessive trophoblastic proliferation, leading to high level of HCG. Progesterone is increased while estrogen levels are relatively low. High HCG causes multiple theca lutein cysts in the ovaries. The cyst disappears within few months after evacuation of the mole, and high HCG also results in exaggeration of the normal early pregnancy symptoms and signs. Notice the abnormal grape-like structures formed due to swollen chorionic villi. This slide highlights key differences between complete and partial mole, which are important for diagnosis and management. The first picture shows the complete hydatidiform mole, and that is the specimen from suction and curettage, while the second picture shows the hydatidiform mole, which is partial because there is a small fetus with hydatidiform mole. Common symptoms includes vaginal bleeding, severe vomiting, enlarged uterus, absence of fetal heartbeat, preeclampsia, and ovarian cyst. In brief, we can find the symptoms of amenorrhea 2 to 3 months. There may be exaggerated symptoms of pregnancy, especially vomiting. So continuous vomiting may be present in case of hydatidiform mole, where Symphoricarpus racemosa is the medicine. Symptoms of preeclampsia may be present as a headache and edema. The main complaint in hydatidiform mole is bleeding, and this is due to separation of vesicles from the uterine wall, and there may be a blood stained watery discharge, and the watery part is from the rupture of the vesicles. The color of the discharge is prune juice like. The blood is brown because it has to retain for some times in the uterine cavity. The blood may be concealed, causing enlargement and tenderness of the uterus, but the passage of vesicle is always diagnostic. Next symptom is abdominal pain. It may be dull aching, and there is rapid distension of the uterus due to concealed hemorrhage, colicky pain due to expulsion of the vesicles, and sudden and severe due to perforating mole. Ovarian pain due to stretching of the ovarian capsule or complications in the cystic ovary as a torsion. General examination findings may include signs of anemia, high blood pressure, or thyroid related symptoms. On abdominal examination, the uterus feels soft and enlarged, fetal parts are not detectable, and fetal heartbeat is absent in many of the cases. A key diagnostic sign is the passage of vesicles. Ovarian cyst may also be present. In investigation, urine pregnancy test is always positive and serum beta HCG level is highly elevated. On ultrasound, there is no identification of fetus, but the characteristic appearance of the snowstorm, that is of the hydatidiform mole, is present. On X-ray, we cannot find out any fetal skeleton, and X-ray chest must be performed in every case of trophoblastic tumor. Differential diagnosis. The conditions that may mimic GTD includes abortion, multiple pregnancy, and polyhydramnios. Complications include hemorrhage, infection, uterine perforation, hypertension, hyperthyroidism, and risk of malignancy such as choriocarcinoma. The treatment for hydatidiform mole involves immediate evacuation of the mole from the uterus by dilatation and curettage method. There must be cross-match blood should be available before doing this to prevent and to treat the blood loss. In some cases, hysterectomy may be considered. Chemotherapy may be given in high-risk patients to prevent disease progression. Invasive mole occurs when molar tissue penetrates the uterine wall and may spread to other organs. This is a picture of invasive hydatidiform mole which is infiltrating in myometrium. Chorionic carcinoma is a malignant form of GTD. It can develop after a molar pregnancy, abortion, or even normal pregnancy. This is a picture of the specimen of chorionic carcinoma. Symptoms of chorionic carcinoma includes bleeding, infection, abdominal swelling, and symptoms related to metastasis, especially in the lungs. FIGO staging helps classify the severity and spread of the disease. Picture shows metastasis from the uterus to ovaries, fallopian tubes, and then lungs, and lastly the brain. Diagnosis and evaluation is based on clinical examination, especially the X-ray, CT scan or MRI, and establishment of the HCG level in the blood. And from that we can diagnose and evaluate the condition of the patient. Treatment depends on risk category and may include chemotherapy. Placental site trophoblastic tumor is a rare tumor arising from the placental implantation site. It grows into the uterine muscle and is relatively resistant to chemotherapy. The picture shows placental site tumor. Treatment of placental site trophoblastic tumor. Surgery is the main treatment. HCG levels are usually lower compared to the choriocarcinoma. In homeopathy, we can treat hydatidiform mole, and we are having specifically two medicines where the indication in boric and Allen's knot for expulsion of the hydatidiform mole is written, and I am going to describe these two medicines in my next slide. The first medicine to be thought of is Sabina. It helps to expel the retained uterine content like moles or placenta. There is a characteristic back pain radiating to the pubic region. There is heavy bleeding which is bright red initially and then dark clotted. It is aggravated by movement, but it is relieved by walking also. So this is the controversial symptom, and you can say it is a characteristic symptom of Sabina. It is associated with uterine atony and strong after pains. It is useful in post-abortion or premature labor inflammation. Patient is very sensitive to music, so music makes her weep. And in Allen's keynote, it is typically written that it promotes expulsion of mole or foreign bodies from the uterus. So this is the specific medicine we can say for the hydatidiform mole according to Allen's keynote. Cantharis is the second medicine which is used for the expulsion of hydatidiform mole, dead fetus and retained placenta. There is marked burning pain throughout the body with extreme weakness. There is frequent urging to urinate with scanty or blood-stained urine. Associated with uterine and bladder inflammation, there may be puerperal metritis. Continuous uterine discharge aggravated by the movement. There is severe burning ovarian pain with high sensitivity. Sharp tearing pain in the coccygeal region. So these are the two medicines, Sabina and Cantharis, for hydatidiform mole, and it is precisely written in our Materia Medica. In concluding remarks, I want to tell you only one thing is I had seen so many cases of hydatidiform mole in my early practice when I was with Dr. K.K. Raje. But then after when my practice from 1986 onwards, I didn't see any type of hydatidiform mole cases. But Sabina is useful in cases of uterine bleeding and expulsion of the products of conception which is remain in the uterus. So that is the best part. The same thing with the Cantharis, that it is used where there is a burning pain and there is urine complaints more, there is burning stinging pain in urine, and the patient is having retained placenta. You can use this medicine Cantharis. If hydatidiform mold, if you find out in your practice, these are the best medicine to use, and I'm sure you will get the result. At last, I'm thankful to you for watching this video. If you found it is helpful, then please like, share and subscribe to this channel. See you in the next video. Thank you.